with each edition of the Big Sky Town Hall, we always love to have a health expert join us. So the next up, we're going to shift gears and have Kaley Burns from Big Sky Natural Health talk to us a little bit about her business, how she's kind of adjusted from a small business perspective, but also on some alternative methods of making sure we all stay healthy and happy. Kaley, welcome to the show.
Thank you so much. Thank you for having me and putting this on. Feeling very fortunate to be in this community at this time. I'm a Minnesota native, so it's great to be in some fresh air.
Wonderful.
So I'm originally from Minnesota. I moved here in November, opened up in December. For those who don't know what naturopathic medicine is, essentially I'm trained in primary care. My focus is the whole person, very patient-centered. We have kind of very unique relationships with our patients, and always looking for the underlying cause. So I have the primary care background and then additional training in things like regenerative medicine, IV nutrient therapy. As a relatively new business, this was a very interesting turn of events for us. But really our goal at this point is to stay connected to the community, to our patients, just to make sure that everyone knows that we're still here for them. And as things are opening up, it's starting to pick up again a little bit more. I think this has been a bit of a wake up to some people in terms of realizing how important our health is, especially in times like these. And the doctrines of naturopathic medicine, nutrition, movement, sleep, digestive health, social connections, all of these are pretty key in determining how healthy our system is and our health outcomes. So we really work with people to make a very individualized plan for them, whatever their goals may be. And it's great to be in such a health-oriented community. Everyone's pretty active up here, which is great. But I think we can kind of find comfort in the fact that we all can take some control in our health, and the health of those that maybe we care for, children, parents, things like that. A lot of us were going through life a little bit fatigued and run down, and we've gotten used to this different rhythm of life at the moment. But that really, to me, just signals that both our physical and our mental health are going to need to be resilient as we move forward. And there's a number of ways to do so. But I think that the biggest thing to think about is we hear a lot about these populations that are predisposed. They have underlying comorbidities that maybe make them more susceptible. And a lot of these are what I might consider things that could be modifiable with lifestyle factors. So, whether people are starting to think about a preventative standpoint or looking deeper into the underlying cause of what's going on, my job really is to help educate and empower and provide some resources for people in terms of taking care of our bodies and our minds in a more sustainable way. And I think a lot of people are starting to realize that there's some changes that can be made in their lives moving forward that are going to benefit their overall health. We definitely have to adhere to the public health measures. These are really important when we talk about population health. But as a naturopath, the power and efficacy really lies in helping individuals. That's what makes up our community. So we each have our own unique responsibility moving forward here. And I think we can learn a lot from this time. This is a great opportunity to focus on our health, focus on what unites us. As Senator Daines was saying, I think Montanans are pretty amazing in their ability to work together even from a distance. All my patients are real people with real concerns and health barriers that all need to be addressed. And whether we're doing that through telemedicine or some essential in-office visits, we're here for our patients, we're here for the community, and just hope everyone can play a responsible role in all this.
Wonderful. Well, welcome to Big Sky. Anyone that's willing to open up a small business in Big Sky, I'll speak on behalf of all the other business owners. Welcome to the party. We all help each other out. So, maybe give us a couple examples of some of the common threads you've seen the last 8 weeks of either common things people are seeking advice from you on, or let's get into maybe showing a couple examples of things that you'd share with the audience of advice that you've recently been given or would give to people during these times.
Yeah, definitely. So my passion really lies in nutrition, which is something a lot of people have been talking about recently. I consider that to be our foundation for health. So whether we're taking supplements or medications or doing exercise and things on top of that, nutrition is really our foundation. We can't out exercise a bad diet. We can't out supplement poor nutrition. So it's definitely a place that I think a lot of us can focus on. And I think often it gets overcomplicated. So just kind of taking an honest look at where we're at. Do we need to have some more fiber? Could we add some more healthy fats? Am I drinking enough water? It's a huge one. All of that's going to affect how well we sleep and our energy, our mental health. So a lot of things that people know, it's just kind of a matter of finding the steps to get there, which is something that we've been helping a lot of people with. There's a number of things probably bouncing around the media, various vitamins. In the wonderful state of Montana, a lot of us are going to need some vitamin D. We're sort of getting sunshine out now, so that's helpful. Vitamin C has been a big one. There's a frontline COVID task force that's doing IV vitamin C in conjunction with other things like the steroids. And finding good results with that. We do IV vitamins in office. It's something that has been pretty popular recently. I guess a couple others would be like zinc and selenium, just other immune boosters. We can get a lot of these from our food, which is good news. So I'm always talking about nutrition. The other would be stress is probably the biggest one that we're seeing, sleep and stress. This is a pretty big change for a lot of our routines and our reality. So, whether that's having someone to talk to, whether that's reaching out and connecting with people, working on our relationships, that's another one that we've found as kind of a heavy focus in recent times.
No, absolutely. Well, once again, you look at it as having all the tools, right? Big Sky Medical Center plays its role in our health initiatives and upkeep, and having naturopath, more of a holistic approach like you're taking, is a really important tool. And a lot of them are under our own control with some good leadership and advice like you've given. What's some other advice you'd give during these as it starts, we're getting into the warmer months, and hopefully getting away from the cold and flu season, then this transitional time of year, is there a certain type of advice that you like to give people?
Yeah, so as we're moving into a warmer months, I think hydration becomes even more important. But I think we're also really blessed here. We can get fresh air, we can get outside, we can be active, and that goes a long way with our health. Those are probably the two biggest ones. And I think, just kind of taking a look at where you're at. We're coming up on allergy season. That might be kind of scary for some of us. It's going to be a little bit of, do I have the virus? Do I have allergies? What's happening here? So again, there's a number of things that we can do in terms of how we're eating. Sugar and dairy are probably two really big ones when we start to talk about allergies, and digestive health. I just can't avoid digestive health. 70% of our immune system is in our digestive system. So that's a huge one to pay attention to. And a lot of people don't love talking about it, but it's really important in how our health, how robust our health response is in our immune system. So, if you're curious and you have questions, it's always good to consult with somebody. And just kind of going back to Big Sky Medical Center, super appreciative of everything they do. And I just kind of wanted to hone in that I think that we can all work really well together, especially as part of a team. It's really important for patients to understand that you can work with both sides. You can have conventional care, and I'm happy, we work together all the time. So I think it really benefits patients that we can have a team and a partnership, and the community, it benefits them as well.
Absolutely. I guess one last question for you, and then I'd let you kind of close out with some thoughts. Are you seeing patients right now? How are you doing that? And what's been kind of your COVID transition the past, 7-8 weeks? And how are you looking moving into the next upcoming weeks?
Yeah. So right now what we're doing is probably about 50% telemedicine, and then some in office and a few house calls for people that we know are safe, quarantined, we feel comfortable with. Currently, I'm the only one in the office. I'm not allowing any other staff members to come in. And then we're screening patients before they're able to come in. We're encouraging people to call first as necessary, doing in-office, in-person visits. But we're also here to connect with anyone over the phone, via telemedicine ways, and just working on the relationships. So moving forward for this week, we're going to kind of keep the same outline. We're spacing patients out about 30 minutes so we can sanitize, clean, trying to reduce contact between patients as well. And we're going to keep doing that for the time being, but we're here, we're open, we're seeing patients, and that includes weekends. So been doing some Saturdays and Sundays too, which is always fun. And yeah, we're here.
Located in Big Sky Town Center, Big Sky Natural Health. Once again, welcome to Big Sky. Kaylee, any closing words of wisdom from the natural health expert of Big Sky?
Just great job to this community. Very impressed with everybody. I think we're super fortunate to have the leadership, the resources, the health that we do, and of course the scenery. So thank you so much for this, and just happy to be here and help support any way we can.